Welcome to our 5 on 5. Pleased to be joined today by Dr. Brian Gross with Southern Oregon Cardiology. Good to see you, sir. Welcome back.
Thank you for having me here.
My pleasure. It's February, of course, Heart Awareness Month, and we want to get this in at the end of the month. You'll take what we can get. Heart disease, obviously, hugely important for both men and women, was something we all want to avoid. Are there common factors, things we should look for both sexes that we can
Absolutely. I mean, a lot is made that women have different symptoms than men, and while there may be a small minority of complaints that way, by and large, it presents the same. If you've got short-circuiting heart rhythms, you'll feel palpitations or fluttering, kind of like a fish in the bottom of the boat. If you're having problems with the heart not getting enough oxygen, usually with exertion, but sometimes at rest, you will get some constellation of sensations of a pressure, tightness, squeezing, burning. It doesn't have to be super severe, but it's something that if you're not having that before, you might pay attention to that and talk to your provider about, is this something that needs further workup?
What age should people start worrying about heart disease, taking care of themselves?
Yeah, I think you start worrying as soon as you start taking care of your first baby. How you set the standard of feeding them and making sure as they get older they get a fair amount of exercise, that sure, we need to be computer and digitally literate these days, but you also need lots of good exercise. Make sure they get outside and do that. Feed them a good heart healthy diet, lots of fruits and vegetables, plant-based stuff if at all possible, and that's what they learn to love. And then it's not a problem trying to switch at age 40 or 50 when you've already established the kind of foods that you love. It's hard to change at that point.
Is it possible to reverse the disease if a person starts to get
I think there's some evidence that you can reverse it a little. Usually what happens, the body has tremendous reparative capability. And if you wind up with a blockage or an arrhythmia, you can stabilize it with diet, exercise, medications, therapies, interventions that we do, and then your body will be able to adapt to that and sometimes even be better. So yes, you can reverse a little bit, but stabilizing and preventing it from getting worse is probably what we mostly achieve.
What about misconceptions when it comes to the heart or a heart-healthy diet? What's out there? You know, there's so much information out there for all of us. What do people need to know? Yeah,
well, depending on what aspect of the heart issue you want, there's lots of resources online nowadays. Just go to a reputable source. You know, go to Mayo Clinic or Hopkins or the Asante website, our website, Southern Oregon Cardiology. We have lots of links there that will give you stuff that has a strong body of evidence behind it that this is real, not imagined. This is real, and it's been bolstered by scientific evidence. Some of the misconceptions, of course, are many women think that the leading cause of death is breast cancer. Far from the truth. Very, very important cause of death, something we can intervene on, but also heart disease is by far and away. Cardiovascular disease, by far and away, the leading cause of death in women and men combined.
Wow. Okay, we're going to take a quick commercial break. Much more in just a moment. Stay with us. Welcome back to our 5 on 5. We're going to hear with Dr. Brian Gross from Southern Oregon Cardiology. Of course, it's Heart Awareness Month in February. I want to ask about vaping, though. You've seen what's been going on the last 6 months to a year. How do you approach that as a cardiologist?
Well, I guess the good news from my standpoint is I don't have to see a lot of young men and women, but I think this is a terrible problem. You know, they've just substituted one vice, the smoking cigarettes, to now inhaling huge quantities of stuff. We don't know what that stuff does in the lungs. And when you watch the exhalation of this stuff coming out, I mean, we weren't built to be doing that kind of breathing. And there's all sorts of substances that are contained in this vaping material, and we don't know what that does. So my counsel would be, don't do that.
Interesting. Okay. Can people die of a broken heart?
Yeah, there's this interesting concept that we've become more acquainted with over the last 18 years called broken heart syndrome, apical ballooning cardiomyopathy, Takotsubo syndrome. It's interesting. It's usually an affliction that gives you all of the symptoms like a heart attack, and it's almost always, about 95% of the time, in postmenopausal women who have just experienced some kind of stressful event. Now, why doesn't it happen with the million other stressful events? We don't know, but it's felt to be due to a short-circuiting of the nerves that surround the heart and literally cause a large portion of the heart to stop working. And if you don't die, and you can die from this, about 3 or 4% of people can, they almost always will make a recovery within a couple weeks or a month, both EKG and heart muscle function. It's a very challenging and interesting concept, and it's indistinguishable in terms of its clinical presentation from a heart attack.
Wow, okay. And what about young people having heart attacks?
Yeah,
you're telling me something. During the break.
We see a few of those. They're always tragic, but they probably have a different physiologic cause than somebody who's got a lot of plaque building up in their arteries. Especially young women, sometimes around the time of birth, the heart artery is kind of like a roll of paper towels. And what happens is, instead of plaque building up on the inside cardboard, you develop a split or a crack in the cardboard, and then blood courses into the towel section and collapses the vessel. And it's important that that's recognized, because therapeutic options are significantly different when that occurs.
What should people look for if that?
Well, they'll have symptoms which are virtually identical, and the EKG will change, and it's just that we as healthcare providers have to be careful to make sure that we approach it in a more conservative fashion, if at all possible. If it's a major artery, then we have to approach it very aggressively with our stents and bypass surgery.
Wow. Well, I appreciate you taking time. Good to see you. Thanks very much.
Good to see you. Thank you.
Stay with us. We'll be right back.